I chose to do my project on a pneumonectomy, which is the removal of an entire lung. I chose to do this because I am really interested in cardiothoracic surgery. A person would need to have this procedure if a smaller surgery did not solve the problem, or if the patient had a tumor that was closer to the medial side of the lung rather than the lateral side. They would also need this procedure if a patient has lung cancer, which is the most common reason, a traumatic lung injury, pulmonary tuberculosis, or a fungal infection of the lung. This procedure could help cure any of these. If a patient needed this procedure but did not have access to it, then their condition would get worse, leading them to possibly need a full lung transplant, or it could lead them to death. It would also cause more complications with the lungs in the future. There is no specific group that would need this procedure. Those with lung problems that could not be solved by a smaller operation would need this. Smokers and older people have a higher chance of needing this procedure, as lung problems are more common and serious in these groups. This is a procedure used to fix a lung issue, such as a tumor, or cure a lung disease, like pulmonary tuberculosis. A patient could also have this done as a type of pain therapy. If they wanted to prevent more pain and their condition getting worse, they could have this done. This procedure is done in a hospital, in an operating room, and is done by a cardiothoracic surgeon. This is only some of the equipment needed. I couldn't find a full list on the internet, so I used common sense. Some of the equipment needed is a double lumen tube, 2 peripheral venous lines and an arterial line, a soft tissue retractor, PPE, a suturing tool, a stapling tool, an endocatch bag, an endotracheal tube, antibiotics, anesthesia, and standard surgery equipment like a scalpel, forceps, etc. There are many preparations needed for this surgery. The patient will need to tell their healthcare provider of any medications that they take, including over-the-counter medicines. They will most likely need to stop taking these medicines, especially if they are blood thinners. The patient will need to quit smoking if they are a smoker. The patient will also need to inform their healthcare provider of any allergies they have, including reactions to latex and anesthesia. The patient should exercise daily before their surgery and do breathing exercises with a spirometer, which measures how much air is going in and out of their lungs. They should not eat or drink something after midnight on the day before their surgery. The patient will also need to remove their hair that may be in the place of the procedure. The patient may also have to take any of these tests prior to surgery, such as a chest x-ray to see the heart and lungs, a chest CT scan to get a more detailed picture of the lungs, a PET scan to look for cancerous tissue, an electrocardiogram to look at your heart rhythm, pulmonary function tests to see how well your lungs are working, a ventilation perfusion scan to figure out which areas of the lung contribute most to breathing, and blood tests to check your overall health. Right before the procedure, the patient will most likely be given antibiotics to help prevent an infection, and they will be given anesthesia that will help put them into a deep sleep so that they will not feel any pain during this procedure. They will also receive an endotracheal tube placed in their mouth, which allows for a ventilator to regulate breathing during the procedure. During the procedure, number 1, the patient will be laying on the side opposite to the one that is being worked on, with the arm of the side of the body being worked on above their head. The surgeon will start the procedure by making an incision a few inches long between 2 ribs, usually the 4th or the 5th intercostal space, on the posterior lateral side of the body, depending on the left or right lung being removed. The cut will be going from under the patient's arm to around their back. Number 3, the surgeon will then proceed to cut into the muscular tissue until they get to the ribs, usually doing so with a suture tool that will help them with the bleeding. Number 4, once they get to the ribs, they will spread the 2 apart, maybe in some cases take a small part of the rib out to make the removal of the lung easier. In other cases, the surgeon does not need to spread the ribs apart very much. Number 5, the surgeon will also cut the connective tissue that connects the lungs to the pleural cavity. They will continue to use the suturing tool. 6, the surgeon will then deflate or collapse the diseased lung. 7, they will proceed to staple or disconnect any major blood vessels, aka the pulmonary vessels, to prevent major bleeding into the pleural cavity using the stapling tool. This acts like a suturing clamp where it blocks off both passageways without the vessels bleeding everywhere. 8, they will also clamp the bronchial tubes leading to the diseased lung to make sure that little or no fluid will enter the air passage. Number 9, the surgeon will cut through the bronchial tube, which will separate the lungs. 10, they will then insert an endocatch bag into the cavity, in which they put the lung and the end of the bronchial tube into to try and make the removal easier. 11, the surgeon will take the bag out and insert the drainage tube between the pleural layers to drain any fluid and or air that was in the pleural cavity that was operated on. 12, entering the surgery, the surgeon will stitch up the incision they made to remove the lung. The risks that go along with this surgery is respiratory failure, pulmonary embolism, a blood clot in the lung, pneumonia, shock, complications that involved anesthesia, blood loss, abnormal heart rhythms, and reduced blood flow to your heart. Your age, medical history, and other factors will decide what types of risks and side effects you may see. This procedure is often painful and has a long recovery. This means that the patient is often uncomfortable for months after getting this procedure, but they feel better after they heal. Their activity is limited for 1 to 2 months, so they may get extremely bored during that time. In the recovery period, the patient will wake a few hours after the surgery is done, and their vital signs will be monitored to make sure that they are in good condition. The patient may get oxygen through a small tube in their nose. They will also perform breathing therapy to help them remove the fluids that built up during surgery. The patient will wear compression stockings on their legs to make sure that no clots form. The patient will need to stay in the hospital for a few days to monitor their conditions. Once the patient goes home, they will need to make regular checkup appointments. The patient will also need to continue using their spirometer during their breathing therapy. Your pleural area without the lung will slowly fill with the fluid. Of course, the patient will need someone to take care of them at home, and they will need lots of rests. This procedure will greatly improve someone's life, especially if they have a progressed lung disease. I would only encourage this as preventative medicine if it was certain that there would be further lung complications in the future causing more pain. There are many benefits to this procedure. It would solve the lung problem quicker rather than having to go through multiple smaller procedures that did not work and then needing this big surgery. There will be less long-term pain as you are solving the problem quicker. You do not need 2 lungs to live. The doctors are highly trained and they would take good care of their patients. It would ultimately make the patient feel better. Some random facts are that you can live without a lung, although you may not be able to exercise as much. The surgery takes a few hours. The mortality rate of a right-sided pneumonectomy was 17.4%, while the mortality rate for the left-sided pneumonectomy was 5.6%. The overall mortality rate was 11%. This is my works cited page. I chose to do my project on a pneumonectomy, which is the removal